Are you a good sculptor? It's
Oh.
time to shape the femur, tibia, and patella so the new knee components fit properly. A hole
Okay.
must be drilled inside the
A
femur to
drill?
set up the distal femoral cutting jig and alignment device.
They don't use a drill, do they? Off.
The jig is put into position and
No.
helps ensure that the cuts made to the bone are exactly what are needed.
No,
Now
no.
hammer in the pins to hold the jig.
Oh, this is horrible. Hey, we're just shaking my rhythm. My name is Jolly Driver. Welcome to a game called Fight. Virtual knee surgery. That's what it's called. Yeah, we've got some doctor here. Hello, doctor. Please turn on speakers or plug in headphones. Speakers. You may turn on subtitles and shut up. You may turn on subtitles.
Welcome to virtual knee surgery. This activity will show you the process of replacing a failing knee joint. Are you ready? Today, our patient is a 76-year-old man. It is mandatory to check the patient's vital signs before beginning surgery.
Oh.
An anesthesiologist in the operating room performs this step. If the patient's vital signs are not in the normal ranges, we will not proceed with the surgery. Using the healthy person's vital sign chart as a reference, can our patient undergo surgery today?
I don't know if okay, normal. I don't know if normal or no. I don't know if those things are good. Probably.
It looks like surgery will proceed as planned.
Okay.
Take a moment to look at our patient's x-rays. Which knee do you think needs surgery?
The left knee.
You're right. His left knee appears worn down and lacking cartilage, which is likely the cause of his pain.
Yeah.
The nurse has begun prepping our patient for surgery by placing an IV needle in his right hand. Now
Okay.
it's your turn. Use the marker and write your initials on the proper knee to be operated on. This may seem silly, but it's an actual step taken to prevent wrong site surgeries.
Yeah. Okay. Initials. What like? So can I do JD like JD? JD. I'm tired. I'm not thinking properly. So write your initials. Can I do any?
Nope.
Oh.
Nope.
Oh. On that one. Did it matter? Oh. I want to get this perfect.
Nope.
Oh, just this one then, yeah?
The
Oh, yeah, 'cause that's the one
anesthesiologist
that's broken.
administers drugs through the IV and through a mask over the patient's face. What function should these drugs perform?
Analgesic to kill pain? What? Paralytic agents to keep patient from moving. The patient I prevent the leg from swelling?
Nope.
Nope.
Good work.
Alright, second guess. Oh, 3?
No. Great. Fantastic. After the patient is unconscious, and before the first incision is made, we need to establish a sterile field around the surgical area.
Okay.
A series of sterile drapes isolates the surgical field from the rest of the patient's body. A tourniquet is applied to cut off blood flow, which allows a clearer view of the surgical field during surgery.
Okay.
To kill the bacteria on the patient's leg, clean it in a betadine solution. This scrubbing process will limit the chance of bacterial infection.
Oh, the sponge. Okay. There we go.
The betadine scrub is applied 2 more times, followed by the final arrangement of sterile drapes.
Oh. Oh, right. Oh.
Why do you think knee surgery involves so many drapes?
I don't.
No.
It's a hospital fashion trend.
Good work. Use the
Okay.
sterile marker to draw the location for our incision. And don't forget to mark the perpendicular lines too.
Okay.
Typically, the incision line is 6 to 7 inches long.
Okay. like this. They're not perfect, but oh, that's bad. Am I gonna get into trouble for that? Maybe not. Ah, we'll be fine.
What purpose do you think the perpendicular lines serve?
Oh, we're learning things here today. To help alignment, to indicate which knee needs surgery.
Nope.
Oh no?
Outstanding.
I keep getting it
Now
right
for
a
the
second.
incision. Take the scalpel and cut the skin following your markings.
The scalpel. Nurse fetches the scalpel. Oh my.
Let's use the Bovie pencil to cauterize the veins. This will help decrease blood flow into the surgical field.
Okay. I've got... and... oh. Because it's bleeding, this helps get rid of the blood, does it?
The rake retractors fold the skin and tissue out of the way, exposing our patient's knee. To operate, we need the patient's knee elevated and bent so the bones are fully exposed.
Okay.
Now
Ooh.
the leg is at the proper angle. Use the rongeur to remove the anterior cruciate ligament, or ACL, the meniscus, and any bone spurs that may be lurking about.
Get the wronger out of the tool. But, oh my god, my back is aching and I'm really tired. Oh my, okay. Then click on the... my chair is so squeaky. And very creaky anti-chair. The wronger, and then we click on the bone, which is called the meniscus. Oh.
Are you a good sculptor? It's time to shape the femur, tibia, and patella so the new knee components fit properly.
Okay.
A hole must be drilled inside the femur
drill?
to set up the distal femoral cutting jig and alignment device.
They don't use a drill, do they? Off.
The jig is put into position
No.
and helps ensure that the cuts made to the bone are exactly what are needed.
No.
Hammer in the pins to hold the jig.
Oh, this is horrible.
We can now remove the alignment device. The pins will hold the jig firmly in place.
Okay.
Now for some real bone shaping. Use the bone saw to cut the bone so it is prepared for the new femoral component.
Oh, good God.
Another cutting jig, along with the bone saw, allows us to finish shaping the femur. Let's move on and shape the tibia. The tibial cutting jig is aligned with the big toe and the highest point of the tibia.
Yeah.
This will ensure the leg is properly aligned after surgery. Secure the jig in place with more pins.
Grab the mallet. Oh, mallet. Mallet. Do I really use a hammer and a drill and a bone saw?
Prepared for the new tibial components.
You're not telling me they really do that.
Now we'll use the patellar cutting jig and bone saw to remove the back of our patient's patella.
Okay. It's this thing. Oh, bone saw.
Holes in the tibia and patella are drilled and chiseled out, which will enable the new components to attach properly.
Okay.
Time to place the trial components. First, attach the femoral trial component.
What's that over? This thing.
Attach the metal tray trial component to the tibia.
Cement? Why do we need cement?
Insert the plastic trial spacer into the metal tray component.
Plastic spacer.
Lastly, attach the patellar trial component.
There we
Why
go.
do you think the two tibial components are inserted separately instead of as one unit?
I don't know. For parts only sold separately.
Fantastic.
Hey, you got that right. But it was
Conduct a
just a
range of
guess.
motion tests to assure proper knee alignment and successful prosthetic fit. Typically, a normal range of motion allows the leg to move from 0 to 130 degrees. How does our patient's range of motion look?
Yeah.
Knees aren't meant to bend sideways, so it's important to determine whether there is a gap or space between the femoral and tibial components. There's no noticeable gap, so this knee is a good fit.
Oh, okay.
Why do you think there are so many steps taken to ensure proper alignment?
Complications for the...
Great.
Yeah.
We've tested the trial components. Now let's remove them and prepare for the permanent components by applying a special cement compound that binds metal and plastic to bone. The scrub technician has mixed up a batch of cement for you to use.
Okay. Well, like actual cement. It just looks like green slime.
With the cement in place, the final components are permanently attached to the knee. Any excess cement will be scraped off and thrown away. Lay the leg flat on the table so the new knee components put pressure on each other. This allows the bone and components to bond with the cement. The cement can take anywhere from 10 to 15 minutes to harden.
Okay.
We perform our range of motion tests one final time. Our patient's new knee is looking good. Let's close up the incision. First, suture the deep tissue and fat layers back together.
Grab the suture. There we go. We're doing very well.
Closing the surface incision, you have a choice between the stapler and the suture.
I'm choosing this. I'm not choosing the stapler. Having nails inside of it? Good God.
What is the primary difference between these two methods of closing the incision?
Staples set off airport security. I don't know.
Excellent. You know,
okay.
We couldn't ask for a better participant. You've done an excellent job. Are you sure this is your first total knee replacement?
Yes.
Our patient will remain in the hospital for 3 days, followed by 3 to 8 weeks of physical therapy. Because of this surgery, our patient will have significantly reduced pain and increased mobility. Before you leave, let's think about the life of the new knee components. What kind of forces do you think the new knee will need to withstand?
The weight of the body... This one.
Nope. Nice job.
Okay.
People average about 5,000 steps per day. Our patient's new prosthetics will withstand a great deal of force for 36 million steps or more. I'm off to check on another patient while the OR team prepares the room for the next surgery. You've been a great help. See you next time.
See ya. His lips are still moving. His mouth's still moving. Is that it? Right, well guys, I think that's it. That was virtual knee surgery. We became a doctor, a surgeon for today. I think there's more surgery games like this, and if there are, I'd like to play them. But yeah, that was really cool, and I learned a few things as well. I mean, I wasn't really paying attention because I'm really tired, and yeah, that's about it. But for now, thank you my brilliant buddy so much for watching this video. If you enjoyed it, don't forget to smash that thumbs up button. See you in the next video. Remember to turn that fan upside down. Have a lovely day. I'll do this.